Hi, I'm David with WheelItForwardUSA.org. Today we're talking about canes. There are a couple of things to be aware of universally with canes. The cane tips should always be inspected before giving a cane out to a borrower. This particular cane tip has no tread left on it, and it would be slippery in a damp or wet environment and should be replaced before given to the end user. As an example of a good cane tip, this particular cane tip has more tread on it, much more visible, and is much safer for the end user to use. There are also two different styles. There's a offset cane and then just a standard cane handle. Properly adjust the height of a cane. The factories recommend that the height be set where the ball joint of your wrist is, which is also the location that your watch would normally rest on. Your hand at your side, the wrist extended. That is the normal position. It allows for a 30-degree bend in the elbow. You should, however, check with your medical professional, PT or OT, to ensure that this is the proper setting for you. When a cane is set properly, it can be used either for balance or for weight disbursement. Somebody that is using a weight disbursement method cane, you would always want to make sure that you walk forward. If it's a right leg injury, you would walk forward with the cane and the right leg and bring the gait through to your left leg. Otherwise, weight transfer is going to be used based upon what the PT and OT recommend in your particular circumstance. Small base quad canes are also a useful piece of equipment. The adjustability of the small base quad cane is same to the other single point canes. The adjustment point should be at the ball of the wrist, and that would be where your watch also falls in place. On a small base quad cane, the feet are angled differently, and the larger feet protrude to the outside of the cane when properly in place. This cane is set up to go on this side of the body, and we would turn the cane by releasing the wiggle, pushing in the plunger point, and spinning it back. This now makes the larger legs to the outside of the unit, making it proper for the other hand. There's another small base quad cane that has a little different feature. This one is a little bit smaller, and so you would want to recommend that you check with your physical therapist or occupational therapist if it's correct for you. This does allow for either hand, left or right, without having to change the position, and it allows you to work with either hand. Also considered a quad base cane because it fits better on a stairway. It also allows you to leave the cane in an upright position should you need to do something with both hands. There's also a cane called a large base quad cane. The large base quad cane is much bigger, broader base. It helps individuals that have more stability issues. Should be recommended by a physical therapist or occupational therapist to make sure it's the right equipment for the end user. As you can see, the base of the cane is much broader, but it also has the same characteristics of an outside edge versus an inside edge. You also make the same adjustments in the way that you loosen this. You push the button in, rotate it 180 degrees, and it's now set up for the other hand use. There is a quad cane that can be also called a step-up cane. The step-up cane comes with a minor little step. It usually is half the size of a standard step. So if you were doing something that an OT or PT recommends is proper use, you can use this cane as a support point when walking. And then if need be, it can be helpful to get up onto a step to go on to another step. And that way, with proper training, be an excellent way to overcome a staircase. It is also adjustable from left to right. This tension ring down here loosened, depressing the button, turning it, lining the hole up again. There it is. So that you now have it properly set up for the other side With quad canes, it's very important to make sure that the proper edge is aligned with the way in which your PT or OT expects you to use the cane. It could be a tripping risk if you are having the cane set up for the right side, but you're using it in your left hand. So it is very important to be clear with your medical professional which hand they want you to use it in and which way the base is set up. A very important feature of the quad cane is having it set for the left hand or the right hand. You want to make sure with your medical professional that the cane is set up properly for which hand you're going to be using it in. If you do not have it set up properly and you're using it in the wrong hand, the feet could then become a tripping risk for you when using the cane. So you always want to make sure that the broader side of the base is to the outside of the body.